Today, I'm going to talk about why it's so overwhelming to find credible health information online and how we can build systems to empower anybody to find better health information. So, I think that finding good health information on the internet has been on almost everybody's mind over the past year, but I started thinking about it about 3 years ago. I was this new 22-year-old grad from Harvard College. I had grown up in Grand Junction, Colorado, and was hired by a clinical trial software company called Creo. So what Creo does is it basically builds software for researchers to better run their clinical research studies. And so the CEO approaches me and says, "All right, Phoebe, so we want you to tackle one of the largest problems in clinical research today." No pressure, right? The fact that 80% of clinical trials fail to enroll enough people to participate. And so I realized that I really had to dive into the issue. And so I started volunteering at nonprofits during the weekends and Googling like crazy and trying to research how clinical trials worked. And I discovered something really interesting. The majority of people aren't even aware that trials are an option. So one study surveyed thousands of people who had just received a diagnosis for cancer and found that 85% of those people weren't even aware of what trials existed for their condition. But out of those same people, 75% said that they would have been interested had they known it was an option. And I realized that it wasn't an issue of people not being interested in trials. It was an issue of people not finding the right information about trials. And that's when I also realized that the problem of low participation in clinical research was tied to a larger question, which is, how do people find health information in general? And so, starting with type 2 diabetes and Alzheimer's disease, I decided to interview a large variety of people. So I talked with people living with those conditions. I spoke with their family members. I spoke with caregivers of people who had Alzheimer's disease. And I also spoke with experts. So I talked with doctors, nurses, clinical researchers, and other clinicians. So to demonstrate what I found, let me give you a day-to-day example. So let's say that you're trying to choose a restaurant to get takeout from tonight. I think the first place that many of us would go to is Google Maps. And so you can see the restaurants that are nearby. And when you choose a restaurant you might be interested in, you can see its online menu and look to see if the food looks delicious, which I think that food definitely does. You can go to Instagram. You can see real pictures of the restaurant. You can see pictures that people have posted. And you can even read about people's reviews on Yelp. So you can like those reviews, you can ask questions and comment on those reviews. And when you've eaten from the restaurant, you can actually leave your own review if you want. But what happens when someone is diagnosed with a life-changing condition? Like my grandma, who has type 2 diabetes. So she might talk to her doctor, and her doctor gives her a few treatment options. And so she looks at the treatment options, and she finds something that looks like this. I don't think that's very helpful for most people, let alone if English is your second language, and my grandma's first language is Spanish. So then she might do the Dr. Google thing. So she looks on Google, and she finds an article on type 2 diabetes, and it looks like this. I have a science degree, and I feel like I can't understand like half of what that says. The information is so overwhelming and feels a little bit impersonal. So let's say that she knows a little bit about research, and so she starts searching for clinical trials, and she finds an ad that looks like this. And she has no idea whether that ad is for a legitimate clinical trial. And just for context, that actually is from a real clinical research study. So then she might go to social media and she finds online communities and real experiences from people, but she has no way of knowing whether those experiences are verified or real medical information. Why isn't health information keeping up with consumer information? I basically realized that health information is separated into these two very distinct groups, and they basically just don't talk to each other. So on one hand, we have medical written information. And that's kind of like some of the pictures that I was showing you a second ago. Information from pharma companies or healthcare organizations that's really highly regulated. So, for example, the FDA requires that when a pharma company shares information about a treatment, they have to include every possible side effect and warning and more. But ironically, many of the experts that I spoke with, the doctors and clinicians, don't often recommend this information to people. And I think it's because while regulation is really important for ensuring that the information is medically reliable, it creates this information that's super dense and impersonal, and in my grandma's case, can even make her feel like she has a worst case outcome possible. So many of the people that I spoke with told me that they instead turned to peer-to-peer information. And so they ended up going to social media and looking at online communities. They might even go to websites that had a lot more relatable information, but wasn't necessarily medically reviewed. And of course, the results of finding medical information can be devastating. In his New York Times op-ed titled "Dr. Google is a Liar," Dr. Haider Vareik shares the story of a woman who had a heart attack during yoga class, of all places. And this woman had been eating healthy foods. She exercised regularly, did yoga, and she didn't smoke. But when Dr. Vareik looked into her medical record, he found that she never started taking a prescription to lower her cholesterol levels because she had read misinformation on the internet that said that the medication was untrustworthy. So amidst all of this, I'm so proud of my grandmother for taking action and researching her type 2 diabetes. Now, with a healthy diet and regular exercise, she actually can manage her type 2 diabetes without insulin. So, to provide people with information that they can both understand as well as actually apply to their lives, I realized that we have to bring the two sides of the table together. Experts who can share their knowledge as well as review whether information is medically accurate, and people actually living with conditions who can share their real experiences. And I also realized that I had to bring on some medical experts who could take these really complicated concepts and turn them into something that anybody can understand. So I recruited this medical board of advisors, 5 doctors, professors, and researchers to basically build this platform with me. And after months of research and designing, we came up with what we called was CareTalk. And CareTalk was a platform that basically connected expert knowledge with community information and stories through articles and videos and comments. And I was really surprised and really overwhelmed at kind of the response to this. We had people from around the US and world who really graciously shared their time and experiences with us. One woman who is living with early onset Alzheimer's shared the courage that she had to speak in front of her state's Capitol building to advocate for the Alzheimer's Association. Another nurse shared these delicious but low-carb Latin American recipes for people with type 2 diabetes by cleverly substituting in ingredients like cauliflower rice. And a professor and scientist from Canada shared his research on Alzheimer's disease and reviewed over 30 clinician-written articles. And that's just the tip of the iceberg. Unfortunately, due to budget changes from COVID-19, CareTalk was discontinued before it ever had a public launch. So what do we do until we have that platform that connects expert knowledge with community experience? I think the first thing that we can do is we can really train and empower ourselves to critically identify what's medical misinformation. And so CareTalk's board of medical advisors created a 4-part framework to do this, and I've adapted it for here. So when you're looking at a health information article, the first thing you can look for is whether it links or references to real scientific studies. And I realize that what a scientific study is can be a little bit vague for anybody. And so Google Scholar actually has this really interesting tool called Top Publications that I use pretty regularly. And it lists and ranks the top real scientific publications. And so if you find an article and you see that it links to a scientific study, you can actually type in the name of the journal into Top Publications, and it'll tell you whether it's listed there. The second thing to look for is timeliness. So the medical industry is changing really rapidly, and we usually recommend that people look for articles that have been written in the past 10 years, if not more recently. While most articles, I think, have the date written on them, a really easy way to do this in Google, if it doesn't, is you can type in after : the date, and that will basically just filter for Google results that appear after or that have been published after that date. The third thing to look for is conflicts of interest. So a conflict of interest example would be if my grandma is reading an article about a new treatment for type 2 diabetes, and the author of that article is affiliated with the company who's profiting from the treatment. That would be a conflict of interest. Now, I don't think conflict of interests are always a bad thing. The most important thing is that the author is actually disclosing or sharing that they're a part of the company that's profiting from that. And I think a good rule of thumb is when you're in doubt about some claim that an article is making is to check to see if other articles that are medically reviewed are saying the same thing. The last thing to look for is graphs and stats. So that would be if looking at the data, if the source of the data is from a reputable location. So the CDC or the NIH or one of the scientific studies that I referenced earlier. And for graphs, you can check if the X or Y axes are making a tiny change seem much bigger than it is. Let me give you an example of this. So recently, one of my family members recovered from having COVID-19. And so my dad and I were researching some articles online, and we came across an article that said that 50% of people with COVID-19 had long-term cognitive impacts. And so, of course, I was really worried when I read this article. And so I started reading the scientific study, and it turned out that the study had actually only looked at people who had been hospitalized with COVID-19. And so while the finding that 50% of people hospitalized with COVID-19 have long-term cognitive impacts is, of course, a really important finding, it's much different than saying that half of all people with COVID-19 had long-term cognitive impacts. My second takeaway from building Care Talk is how important it is for people who are medical experts to share, explain, and discuss information with the public that they know is medically reliable. I was really amazed with kind of the ability of many of the clinicians and researchers I worked with to take these super dense, complicated medical concepts and make them applicable for anybody. And I think we've seen this notably with people like Dr. Fauci during the COVID-19 pandemic, but also the hundreds of clinicians who write op-eds and share articles every day. That information, I believe, is extremely invaluable for anybody because it not only allows us to understand the information, but we can relate to it and know how to apply it to our lives. And that makes us more likely to make behavior changes like maintaining a healthier diet if we have type 2 diabetes. The last thing I'll leave you all with is the onus on those of us, like myself, in the technology industry to build software that better sorts and filters out medical misinformation. That can be Google or YouTube improving their search algorithm so that only the medically reliable information shows at the top. Or it could be Facebook or Twitter or Instagram flagging comments that could be medical misinformation. Or it could be building an entirely new platform like Care Talk that connects expert knowledge with community stories. I believe that we can work together to build a world where anybody, no matter their background or whether they have a medical degree, is empowered to make more informed decisions about their health. Thank you.